going to do today is look at treatment. We've done a lot of work in terms of assessment. I know we talked about assessment and some treatment as it pertains to voice disorders and fluency disorders. In this section, we are going to look at general principles that guide the treatment phase. And we're going to separate it into two distinct components. The first section is going to look at how we select target behaviors during intervention. And target behavior is essentially any behavior that you decide you're going to address, you're going to tackle a behavior that your client might not display or might display infrequently, and you're trying to increase the frequency of that particular behavior. That's a really important part of planning treatment. Because the efficacy, the success of your treatment is really going to be judged on whether or not your client meets those target behaviors. So how you select them is important. The idea that they're appropriate for a particular client, given their characteristics, and given a number of parameters that you may decide to take into consideration. So really important phase of treatment. The second part is really looking at different concepts and different methods that we use in treatment to increase target behaviors. And we are going to take a sort of general approach where we're looking at basic philosophies that will apply across different disciplines, and not particularly disciplines, but different areas of communication. So these are principles that you can apply for articulation therapy, you can apply for language therapy, aphasia, and all sorts. So that's what we're going to do. So you have a fellow like that, how do you decide not to use fricatives as a target goal for him? Why would that not be appropriate? So those are the sort of things that we're going to talk about. Why do we select target behaviors? Why do we need to go through the selection process? There are a number of reasons. The first one is that with most clients, you're really going to have to teach them a number of targets. Simply because when we have a client with maybe an articulation disorder, they're going to have problems with a number of phonemes, for example, depending on the severity of the disorder. If you have a client with a language disorder, they might have problems with morphology, they might have problems with vocabulary, they might have pragmatic language problems. So you've got a multitude of concerns that you need to address. So the challenge then is, which ones do I address first? And why do I select those particular targets? So that's why we go through this process of deciding which ones to tackle first and which ones to leave for later. The other reason is that most clients cannot learn or find it difficult. It's a lot more challenging for them to learn multiple behaviors at once. I think that applies to almost all of us. I don't have a problem. When I'm learning something new, I say, teach me just one thing that I need to know now. Okay, so I can focus on it, internalize it, really understand it, and then move on to something else. Totally different from multitasking when you already are familiar with the number of tasks and you're simply trying to accomplish them at the same time. But when a concept is new, you really do need focused attention. So we need to take that into consideration. Okay? The other reason, and this is really important, is that we really do need to sequence the targets that we address. We may want to address particular targets first and then leave some for later, because those ones that we select to address earlier have more importance, have more functional importance in terms of having an immediate and significant impact on an individual's communication, functional communication. Because that's what we're trying to do. This is why we have intervention, is that we will get a client to a place, a client with deficits in an aspect of communication, to a place where they can function in the real world. That their communication would be adequate for whatever it is that they need to do socially, or what they need to do in terms of academics, if that's an aspect of their life, what they have to do in terms of employment, in terms of their job. So that's what we need to get them. So if I have a young child with language problems, and I'm trying to decide what to do with them, and the child has very little language, or maybe no verbal communication, then getting them to say those single words, and particular single words such as mommy, for example, daddy, that's more immediate, that's more important, and that's going to have a more functional impact on the child's life than, say, a lot of parents that will ask or want their kids to recite the alphabet, because every kid on the playground is doing that. Well, we need to explain why that is not maybe an immediate concern. Okay, and the last one is that some behaviors, most behaviors, particularly with language, have a sequence in terms of acquisition, and so we need to sort of honor that sequence. We need to teach the simpler behaviors first, and then we build on those to get to a client to a place where they can actually accomplish more complex behaviors. We know with language you're going to start off with vocabulary. Before you get to addressing morphology, for example. So if I have a child who has absolutely no verbal language, I would not target morphology. I would not target syntax. So I'm working with increasing the individual words and then beginning to string those words together. So those are the four main reasons why we go through this process of selecting and the things that we need to take into consideration as we decide which targets we're going to address with our clients. There are a number of approaches that sort of help us in determining which targets to address. The first one is the normative approach, which we're very familiar with. And with that one, we're comparing our client to essentially their peer group with regards to age. This is what a 4-year-old child needs to do in terms of language. This is what our client is doing, and this is what they are not doing. Therefore, we are going to target the aspects of communication of language that they haven't acquired yet. So that's the normative approach. And then you have the client-specific approach. And with this particular one, as opposed to taking the normative approach, what we look at is what is it about this client and this client's functioning that prevents them from participating adequately, socially, academically, or professionally. So we look at goals, and we target goals that are going to have an immediate and significant impact on this person's life. Particularly important when we have clients that have a very diverse background in terms of language or culture, because the norms then might be limited and might not offer us the kind of guidance that we need. Where we end up, whether the goals are the same when we use the normative approach as opposed to the client specific approach, they may or they may not be the same. And if they're not the same, that's not a problem. What you have to do is reconcile those differences and determine for your client what is the best approach in terms of your selection of targets. Okay, so a number of guidelines here that we need to take into consideration. The The first one is that you want to use targets that have a significant and immediate impact, really important. Those will be referred to as functional targets. That's a buzzword. The next one here is important for us to pay attention to. Because a lot of us come to the intervention process with a number of theoretical leanings in terms of our understanding of language and how the different components come together. And sometimes we end up targeting behaviors that are really surrogates as opposed to the actual behavior that we need to do. So you might have goals that target attention, for example, when we're dealing with comprehension of language. So we have to be careful. A lot of us will have oral motor exercises when we're dealing with articulation. The question then is, what's the evidence out there that really connects this to the theoretical construct that says strengthening oral motor functioning helps with articulation of, say, fricatives or bilabials? We have to make sure that that evidence is there. The safer way, in any case, is to target the actual behaviors. So I'm dealing with articulation of particular sounds, and that's what my target is in terms of therapy. Okay? If we have strong enough evidence, yes, then we may address some of those behaviors that we think underlie the particular behavior that we're interested in. The other concern here is that you want to expand communication skills, okay? So teach words that expand into phrases, for example. I would, if I was teaching vocabulary, I would look at nouns, I would look at verbs, I would look at adjectives, big, little, for example. Because I can then take those building blocks and combine them, put them together to come up and move the client to the next phase from the individual words to the to phrases, short phrases and sentence by simply using those words that I've been working on. So big, car, for example, you get to combining those. Much more important than working on words that say are not that easily used for a given age in terms of expansion. So if I used numbers, would be a terrible thing to work on. Colors might be okay, but then you're looking at developmentally where the child is as well. Also, those may or may not be a good target. Refrigerator, you're not going to get a lot out of that word. In terms of mileage, so you're looking for words that are going to give you a lot of mileage in terms of where you're trying to get the child. The last one goes without saying, and this is really going to be built into everything that we're going to discuss. The idea that every target that you select has to be culturally and linguistically appropriate for your client. So it's going to go without saying, I'm going to leave it out there. But for every client that you see, if there are any differences, there are linguistic differences, you have to take those into consideration. You need to talk to the family and say, what are your values? What are the important linguistic structures pragmatically or in terms of vocabulary that I need to be aware of? What are family dynamics that is going to clue you into some words that might be important? For example, kinship terms might be more important with a particular child than having to learn some other nouns in those initial stages of therapy. So really important that you have this discussion with parents, family, teachers, and other significant individuals in a child's life to understand how that's going to impact your selection of targets. Okay, we are going to move through a number of disorders, not all disorders, but a number of disorders just to give us an indication of how we may, how the different disorders sort of affect our process. The first one is actually articulation and phonology. So 3 different areas that we'll look at: the procedure of selecting target behaviors, if you have a child with an articulation or phonological disorders. The principles will essentially be the same. We'll look at how you write a good statement to address your target behaviors and what the components are. When you have an articulation client, there are really 3 approaches that you might take. And it depends on the severity of the disorder. It depends on the number of errors that your client exhibits, and whether you can actually see any patterns in those errors. If you have a child with a mild disorder, chances are they're going to be fairly intelligible, and there are not going to be that many error sounds. So in that case, you cannot, or it's going to be very difficult to conduct phonological processes analysis, for example, to see if there are any errors with regards to any patterns with regards to those errors, or a distinctive features analysis. Very difficult to sort of conduct that. And so your approach in selecting targets with that kind of child is to go the route of looking at and addressing just the individual sounds. So it's a sound by sound analysis or target approach. Very simple, just sort of the basic one that we've used for the longest time. You determine the number of correct and error sounds. You look at your sample and you determine those. And then you classify those according to substitutions, distortions, or omissions. Okay? You determine in what word position those errors are occurring, and then select your initial target sounds. Which ones am I going to target? So you have 1, 2, or 3, not that many. And you're going to go through which ones you're going to target, essentially by going back to whether you're going to use the normative or the client specific. In real life application, you're more than likely going to look at both, particularly with articulation. What sounds do I expect my child to have acquired at this particular age? Now, given the ones that it doesn't have, which ones are going to make the most impact in his intelligibility once I work on those? So that's what you're going to look at. If this is a child from a linguistic and culturally diverse background, then you're going to look at that child's language, look at the features of articulation in that language, determine which sounds you expect to see, which sounds have a higher frequency of occurrence and therefore would impact articulation the most. Okay? That is the statement that you're going to write, and the components that are important, 5 important components. You need to have within that statement an indication of what your quantitative criterion is. Okay, so what is your target behavior that you're addressing? That's correct production. In this particular case, you have a WR substitution. It's a correct production of R at 90% accuracy. Why 90%? It really depends on you and the evidence that we have out there. If your child, in terms of their sound, is not producing it, or it's a substitution, so they would, but if they're at 20%, and you're looking at moving them to a particular place by the end of the semester in 3 months, maybe 90% might be too high a target. Maybe you're looking at 60% is where you want to get them to. So there are a number of factors here that are going to go into your consideration of your quantitative criteria. Are they a client that have other issues such as intellectual deficits? Is this a child with autism, sort of compounding their sort of spectrum of problems that they're facing? So all of these factors are going to come into play here. So that's your quantitative criterion. The next statement that you need to include here is an indication of the response mode, in what kind of situation, okay? So this is in conversation, that's where you essentially want to finally get them. If it's an intermediate step, you might have a different criterion. Here it might be at the single word or phrase level, but conversation should be your end target. And then you need to have an indication of the setting. This is in speech, conversational speech in clinic and home. We may not have access to home, so you might just end at clinic. Really important here in terms of how many samples you're going to get, and we have at least 3, would be a safe bet to have. 1 sample would be inadequate. Couple, 3 really will give you an indication that yes, this behavior is now established. And the last one is the number of opportunities that you want in that sample. So really important that you have those, all of those elements there. So that was the sound by sound analysis. For a child that has a number of errors, you can conduct a place, manner, voice analysis. This one again is an old analysis and way of organizing sound acquisition. We have the phonological process analysis, that's a lot more recent, and you've got the distinctive features. But this one has all those elements that are necessary. So in this particular case, you're looking at substitution errors. You're looking at all substitution errors, and then you're classifying them according to similarities. Okay, similarities that are based on place of articulation, manner of articulation, and then voicing. So you could have those kinds of substitutions going on, where you have the village here being replaced with the this is the lingual alveolars here, and then you've got manner here. You've got fricatives. You've got stopping of fricatives going on here, and then you've got voicing and devoicing. So you go through an analysis that allows you to group them according to those errors. And then you teach 1 or more sounds. You're going to get a particular group and teach a couple of sounds from there. The idea here and the advantage, which may or may not occur, is that teaching of 1 or 2 sounds from an error group then translates to the child acquiring the rest of that concept of those sounds that ability rather in sounds that you have been taught. So that can save you time in terms of not having to address each and every sound. Is that going to occur? It may or may not occur. Okay, but if it does occur, then it is a time saver. So that's generalization here. Once generalization occurs, you still have to plan within your sequence of therapy a way of translating those newly taught skills to areas outside of the clinic setting. Okay, really important. That results in sustaining the new skill over time, and also in strengthening that skill. And so many times we have kids that are able to do what we're asking them to do within the clinical setting, and yet when they move out, they drop all of that. And part of that problem is the way we have addressed the reinforcement, is the variety of tasks that we've used. And so building that in from the initial stages really helps in making that strengthening, the generalization, and the functional use of that skill happen sort of more naturally. So this is not a stage that we're going to leave until the end. It's a stage that we're going to build in from the very beginning as we begin to plan intervention for a particular task. Here we have a statement. Again, it's going to have all those components in there. You see how these statements really are the ones that we've been writing. We just need to be mindful that these elements are in there, and we're going to tweak them somewhat depending on the disorder. So this is for voiceless voice substitution, so correct production of voiceless sounds. Really important here that you specify those sounds. So although you're targeting a particular error type, your intervention is going to be with sounds. Let's work with this voice sound or this other voice sound. And then that's going to translate to the rest of the other sounds in that particular group. But you do need to specify the sounds here. So something to keep in mind. You're not going to say, I am working on voicing of voiceless sounds. You can say that I am working on voicing of voiceless sounds by addressing this sound and that sound. So that's an important distinction to keep in mind. The distinctive features analysis, you're going to go through a similar thought process. Determine all the error sounds in your client speech sample, and then you're going to determine the shared distinctive features for all the error sounds that they display. We've got a whole lot of them here. And you're going to teach a few sounds again from a particular group. Hope for generalization to other sounds that you've not targeted, and plan for extended treatment to non-clinical situations. Here's an example of how you would state that. So you're working on with a client that is substituting non-nasals for nasals. Your statement says, I am going to work on production of nasal sounds, and here's a statement in terms of the particular sounds that you're going to address, N and M in all word positions at 90% in conversational speech. So you go through that spiel again. Okay? With phonological processes, the challenge here is really to conduct a comprehensive phonological processes analysis. But once you've done that, then everything else is essentially the same. You're going to select the processes that you're going to target for intervention. And then you're going to teach specific sounds that involve those processes. In terms of selection and prioritizing which ones you're going to address, which processes you're going to address, obviously the processes that impact intelligibility the most. But you also need to look at which ones disappear earlier and which ones disappear later. So we have processes that disappear around 3 years of age, and those that persist after 3 years of age. So cluster reduction, for example, tends to persist. And so that's not one that you would address initially. If you have fronting, I'm probably going to address that. Unstressed syllable deletion, so you need to be aware of the ones that disappear early and address them first. Okay, that's the important distinction here. So you have elimination of final consonant deletion process by teaching correct production of D, L. Again, list those sounds in word final position. You've got your 90% here, you might have a different criterion there. Okay. With regards to language disorders, you are going to address targets in every area of language. Content, use, structure. So having an idea of what we're expecting in terms of language acquisition is important. And so we'll look at each one of these areas and have an example of some of the things that you might consider that come into play as you look at target selection in the different areas. Basic vocabulary for our kids with language problems. Again, because language tends to be such an additive task or ability that you're building on simpler tasks to accomplish the more complex tasks. Vocabulary is going to be more than likely one of those things that you address with the younger kids. What are you taking into consideration? Well, you want to deal with concrete words that name things and actions. So car, milk, child has a toy car, milk, sock, those kinds of things that you can feel and touch as opposed to abstract vocabulary. Things within the environment that the child can manipulate. So they're toys, different kinds of foods, things that have significance for the child. Right. Things that are significant, have functional significance. Okay. Functional significance for the child. So pets, if they have pets, the names of the pets, that would be an important target. The reason why that might be advantageous is because there's more of a need for the child to be able to learn those things. And if there's more of a natural reward for learning those things as well, chances are it's going to, that learned ability is going to be sustained. It's not going to be easily extinguished because it's self-reinforcing within the environment. So that's the importance of really selecting items that are going to have a higher frequency of occurrence, given a child's particular situation, but also going to be self-reinforcing. Verbs are important because you can act them out. Keeps therapy really exciting, changes the pace, that kind of thing. And then adjectives to describe objects and people. So you're looking at that big tall. Here, what you're looking at is the idea of the simple building blocks again. So with these adjectives, red, for example, I can talk about a red car then and get this child to the next phase. Hello, see you. So keep that in mind, that as you work with vocabulary, really where you are looking to get them is eventually over here in terms of pragmatics, conversational ability, but you want to then address syntax and morphology. So how do you lay a good enough groundwork with good representative words that can then work as building blocks to the next stages that you're going to address. Because you're not going to address morphology, you're not going to address syntax until you've built up enough, a large enough corpus in terms of single words and variety of those single words. So keep that in mind. So once you have those single words, you will then move them to simple phrases, two-word phrases essentially, and then to 2 or 3 word phrases. And you see how you're essentially using components that were used in phase 1. So you've got boy, hit, ball. Very easy to sort of string those together and get them here. And then we can begin to look at morphological features, syntactic features. There is no way you're going to use ing for a child that doesn't have verbs, for example. So you need to get those verbs and then you can use the ings, progressive, present progressives, prepositions, put the ball on the table, you can get those in, and then regular plurals. Again, your choice of all of these pronouns, questions, much later on, and negative sentences, your choice of all of this is going to really depend on what's most important in this child's life in terms of their ability to communicate, and what other complicating the factors they have in terms of abilities or disabilities. And lastly, you're going to look at pragmatics. You will look at requests, or what we call commands, so commands, requests, demands. You're going to look at all of those. And then you look at descriptive sentences. One of the problems that individuals with disabilities face or tend to exhibit is this idea that they do not comment as much on what's going on around them, on events, on people around them. So being able to teach them how to do that, to initiate requests, so those kinds of things. Topic initiation as well. It's really tough to get a child to initiate a conversation. Usually you have to ask them, but they're hardly doing that. And part of that is this self-reinforcing aspect of language, that there's a breakdown there. Because we get language in of itself reinforces. So the idea that I am saying something and you are saying something and I say something back, the back and forth, the give and take, that reinforces. So I will ask something in return. But that doesn't sort of occur naturally, so you're going to have to work on that. Topic maintenance. How do I stay on topic? Turn taking. Some of those things might be confounded by the idea that there is a comprehension problem, but they do not know how to repair or to ask for additional information. So I don't understand what you talked about. I don't know how to request clarification. I'm just not going to respond. So you have to tease out what exactly is going on here in terms of some of these that might appear as pragmatic problems, but that might be confounded by comprehension and other language difficulties. Narrative skill, and as far as that is concerned, make sure culture is considered. This idea of telling a cohesive story from beginning, middle, end with that sequence, we know that can be culturally specific. And so before you address that as a goal, make sure you have a comprehensive analysis of the child's background, of the norms in terms of whatever their linguistic background is, a discussion with others, parents, other people that are familiar with that culture. Is it important that I maintain or this child maintains eye contact with a conversational partner? So really make sure, particularly in terms of pragmatics, that your goals are based in solid, on solid cultural information. So that's sort of our snapshot for language and the various areas that we're going to address. The last two that I want to look at in terms of target selection is essentially aphasia and traumatic brain injury. And then we'll move on into therapy. So with aphasia, really complex. And I believe you've done aphasia. If not, you will get that background. You look at that in detail in terms of how those individuals present, the problems and the kinds of intervention that work. But just to sort of summarize that, there's going to be a lot of comprehension problems. There's going to be a lot of naming problems. Depending on the severity, you may be addressing different levels in terms of all of these tasks. But with most clients, you're going to go through this sequence of initially just asking them to point to pictures as a way of accessing comprehension. Objects, simple body parts, point to your nose. So those are the kinds of things that you're going to work on. Asking simple yes/no questions and gauging their understanding from that. So once you've moved from these simple tasks, you will then try and address much more complex tasks such as phrases, comprehension of sentences, naming people, significant others, people within their environment, objects. And they move them along to synonyms, and these are older individuals, obviously, and you're going to take into consideration their premorbid condition, educational level as well. So naming synonyms, antonyms, and rhyming, and then phrases and sentences. You look at pragmatics, and then you look at writing. And in terms of writing, you're going to start with very simple tasks, just imitation tasks, word imitation. So, can you write this word? Can you imitate this word? And then you move on to phrases. Then you're going to move on to writing by dictation. I'm going to say a sentence, and I want you to write that. And then finally, to spontaneous writing. So you're going through the same process as you would with verbal language in terms of complexity. And then reading, finally. Okay? With traumatic brain injury, orientation is a big issue because there's disorientation, there's some behavioral issues. So simple orientation to time and place, to people around them. You're going to use some augmentative communication systems. And then naming of people around them, attending to conversational partners, attending to a topic. You're going to address those kinds of things. And then this is a big one, reducing inappropriate or irrelevant or tangential responses. And that ties into pragmatics. And then finally, you really do need to enlist family support. So those are going to be the sorts of targets that you're going to have for individuals with TBI and aphasia. Okay, so you have selected your targets and you are ready for intervention. So this is the good stuff now. There are a number of things that you need to do in order to be effective with regards to intervention. The first one is that a lot of the stuff that we do involves evoking communication behaviors. So how do we get an individual to display a particular behavior? How do we get an individual to talk, an individual that is not talking? What are some of the procedures, methods that we use to accomplish that? Okay. You may have an individual that simply does not have certain behaviors. That's not part of their repertoire. So how do you create those behaviors so that now the child has, or the individual has acquired words, or has acquired particular morphological structures? Once you do that, how do you increase the use of those behaviors from 1 or 2, from a frequency of 2 times in a particular situation, or 2%, to where those behaviors now are carried on a more consistent basis? And once the frequency has been increased, how do you strengthen that so it doesn't fade? Okay, that the client continues to use those structures, but also generalizes those structures so that they are sustained over time. And then the last one is control undesirable behaviors. If we've been in therapy, we know there can be oppositional behaviors out there. So what are some of the strategies that we have for reducing those undesirable behaviors so we can focus on the targets that we need to address? Okay. So let's address the first one, evoking communication behaviors. There are 3 aspects of 3 processes that we're going to go through when we're trying to get an individual to display a particular behavior. One is instruction. And then we have modeling and prompting as part of that complex. So instructions, the ability to describe the skill that you're teaching. You need to be able to tell the client, here's what I want you to do. That is really the starting point. And the client needs to understand what it is you expect them to do. Now, depending on their abilities or the age, you're going to have to simplify this. You are going to have to maybe supplement it with showing them, particularly with the younger kids. The older clients, This can be done in a more verbal way, but for the younger ones, you probably are going to have to show. So this is the skill that I want you to do. So let's look at for a client for whom you're trying to evoke F production. Okay? That kind of statement. Bite gently on your lower lip. If we've done articulation therapy, we do this without thinking about it. Okay, we are not saying, I am now going to give you an instruction. It happens in a very natural conversational way, and that's what you want good, effective instructions to do, and that's what the research shows. That they're very natural, they're very conversational, they're at the child's educational level, if that's something that you need to sort of take into consideration. At the child's or client's sophistication level, you don't want to talk to or talk down to a client. And so this is, hey, this is what we're going to do because we want to address this and this and that. And always test for their understanding. So if a client is not doing what you're asking them to do, is it because my instructions are not clear? Is it because there's a breakdown in communication? Do I need to restate? Do I need to clarify? Do I need to change my instructions? Totally. So you have to take all of those into consideration. And whenever you change a behavior, you're moving on to a new target behavior, you have to give instructions for that behavior. You cannot assume, well, I gave you the instruction at the beginning so you know what we're talking about. So here are some ideas in terms of other instructions that you may give. This is when you're dealing with morphology. You're working on irregular plurals here. When you see one of these, and you've got pictures, you've got a picture. When you see one of these, it's a picture of a woman. You say, woman, okay? And you have to be very direct. Now, you say woman, and the client says woman, and you move on to another stimulus picture here. This is now with two women on there, and when you see these two, you say women, and you ask them to say it. So very simple in terms of directions. We know, and we do this all the time. It's just understanding that where it sort of falls within this structure of increasing or evoking a response. So you've done that. What you're more than likely going to do is that you're going to pair those instructions with a kind of model. Again, you're not going through this discrete steps. It's all happening in a very uniform and in a very continuous forward-flowing sort of way. So you're going to model what kind of production you want from the client. Okay, so that's the modeling aspect. Instruct client about modeling and imitation. You may have to do that. You may sort of skip that step. Show a picture or an object. Ask a question. What do you see? And then you will model our target response. Okay. Say I see two blocks, and hopefully the client says that. If they don't, then you have to go through some other teaching ways, and then fade that response. So that's modeling here. What do we know about effective modeling? You have to be consistent, okay? Consistent and continuous, particularly in the initial phases, because you're trying to establish the behavior. And then once that behavior is established, then you don't have to model all the time. But then again, don't over-model. So understand what is enough. So in the initial stages, I might model each and every response. The client is beginning to get it right, I stop. I might not model. They get it wrong. Immediately they get it wrong, though I need to apply a model again. It's really important that you reinstate your model. Okay? So that's modeling. You can use a mechanical model. So I can say, look at me, this is the way I do it. Or I can have technology do that for me. Sometimes that's really important. And a lot of us now have iPads. Those are great. They're really great because I tell you what I find, and I'll show you a program here that I really do like to use. what I find with kids, kids with autism, if I'm working on articulation, for example, I'll say, look at my lips and I want you to do this, and they're looking at my glasses, you know, and they're totally somewhere else. And there's this really nice program on the iPad that really works well for me, because it isolates the lips. So they look at it, and the kids will look at it, and they don't look at me, which is really great. So they understand, oh, this is what this guy was trying to do. Now let me look at him and see what he's doing. So I'll quickly go through that just to see what a mechanical model might look at and how helpful it could actually be.
What's the name of the program?
It's VAST. It's VAST, V-A-S-T, autism. And they're specifically designed to help with sound production and words. You move the client from sounds to words, you're going through that same sequence. Then to multisyllabic words, and then to phrases, short phrases. So this is what I would do. This is what a model might look like, a mechanical model for, this is for syllables. And so you would want them to say ma, ma, and then mama.
Mama.
You see how the lip area is isolated?
Mama.
And the kids really cue into that. And it goes through different sounds. And so you would decide for your particular client which sounds are relevant for them.
Pa, pa. Papa.
And I would use that model and then include a live model as well for the child. You may have to include manipulation, physical manipulation to help them. So those are the syllables. If you're working at the word level, you've got simple words. And that's up.
Up.
And you can pause that if you want them to repeat the model. And then go on the second one. And so the first one typically is slower than the next one. This is a good one, eat, with the kids that we work with, the younger kids. And you see those exaggerated, that exaggerated posturing. So you've got your words, and you may go to, these are multisyllabic words, and then you go to phrases, short lists, as you move them down. I'll just have a quick look at those. Oh, God, come here. Eat cookie would be one you've dealt with. Eat, you have addressed that. You may have addressed cookie, so you move them to a simple phrase, very functional phrase.
Eat cookie.
So those work really well, and I
Cookie.
like that program, and it's really been effective for me with a lot of the kids that I see. Particularly with autism, and it's amazing. There's that sort of inherent ability, and we know this from the younger kids. The reason why we're nursing them at that level is because it really allows them to focus on facial features. But there's just that tendency, and they will look at the face. And I'm still very interested. The trick then is to try and evoke responses to get them to say the things. So that's modeling as a part of this process. Well, you're going to model. There's another skill that's very similar to modeling, and that's prompting. The only difference with between modeling and prompting is that with a model you give the entire response. And with prompting, you only give a partial response. So it could be a verbal, it could be a gestural prompt. With fluency in particular, you can use hand gestures to prompt the client to reduce the speech rate. Just something like that. You may use that to indicate airflow management, that to indicate easy onset. but keep it very subtle, okay, and simple, and then just fade those prompts slowly. So you've got your response, you're beginning to get it. If you're lucky, you get the entire response. In most cases, we do not. We get an approximation. So then how do you shape that response? Really important. Because you're teaching the simple steps that are going to get you to the final response. And shaping has got to do with reinforcement, okay? When you decide on a target, it's really important that you have an idea what the constituent steps are going to be to reach that target. So break down a response into its simpler forms. And then decide for your client, where am I going to start? So you're not essentially always going to start at the simplest response. That's going to be dictated by your client. What is it that my client can do within this sequence of steps? And that's where I'm going to start. And then you teach and shape that response, always with a movement towards the final target. But that shaping is going to involve a lot of reinforcement. What do we know about effective shaping? You're going to have to use modeling, you're going to have to use manual guidance sometimes, but reinforcement is really important, okay? So when a client reinforces, or a client imitates a response, reinforce that imitation. That is what's going to make it more likely that the client is going to say that response again. But you're going to have to fade those instructions, okay? You're going to have to fade the reinforcement as well, systematically. Okay, let's see where we are. We are running out of time. What kinds of reinforcement? Well, positive reinforcement is reinforcement that increases the chance or the likelihood of a particular behavior occurring again. We have primary reinforcers and secondary reinforcers. We always hear this, that primary reinforcers do not occur naturally in communication. Well, they can. They're not the greatest reinforcers. For example, if I say my physical state dictates that I need a drink because I'm thirsty, I say, can I have a drink? The only thing that's going to reinforce that is a drink. I need a drink. Telling me, oh, you're fine. Oh, why don't you just think of a drink? It's not going to cut it. So sometimes these primary reinforcers do occur naturally in communication. But in most cases, we do not want to use them. They're sort of our reinforcers of last resort. You know when a child's learning language and they say daddy for the first time, you don't go to the refrigerator and get them a cookie as a reward. You know, you're using these social reinforcers here. The smile, the touch, the verbal praise. So whenever you use the primary reinforcers, you are going to couple those with social reinforcers and then fade the primary reinforcers, retaining the social reinforcers. So that's how you're going to use your reinforcement. Reinforcement schedule, really important in terms of whether that behavior continues or whether that behavior extinguishes. There are a number of reinforcement schedules that you're going to have. You have continuous reinforcement, fixed ratio, variable ratio. With continuous reinforcement, you're reinforcing each and every correct response. And you're going to use this in the initial stages as you try to establish a behavior but not sustain a behavior. Because what happens with with continuous reinforcement is that as soon as you stop it, the behavior is more than likely going to extinguish. So you're going to move from continuous as soon as this client shows an ability to produce a behavior to a fixed ratio, some kind of interval reinforcement schedule. It could be a fixed ratio, a variable ratio. With a fixed ratio reinforcement, you're reinforcing every X number of correct responses. So in a fixed ratio 5, you're reinforcing every fifth response. If it's a fixed ratio 2, every second response. And then you have a variable ratio reinforcement schedule, where it is the ratio of number of responses before a reinforcer is given that matches, and that's constant. So these are really important. And then the DRO, which is a differential reinforcement of other behaviors, is when you specify which behaviors will not be reinforced. Okay? So everything else you can reinforce, but I am not going to reinforce you getting up and walking around, because that's the behavior we're trying to get rid of. Okay? So some simple rules here. Begin with continuous reinforcement and then use the fixed ratio reinforcement when rates have increased. Okay? You're going to lower your ratio. Once you lower your ratio and you lose the response, then you want to get that ratio back again. So you reinforce more to get that response re-established. Okay, the last couple of things that I will talk about, essentially the sequence of treatment. Baselining is really important. We may have a client that comes in with a report. That information may be outdated, but more importantly, that information, diagnostic information that we get is typically reliability is suspect. Because when you administer a test, I may only have one opportunity, or you may have one opportunity to display a particular behavior. And that tells me whether you have it or not. However, that's not enough, particularly when I'm addressing a particular target in therapy. So baselining, one, gives me current information, but it also allows me to extensively look at your ability to produce a particular behavior. So I am going to have repeated measures. I am going to have a whole number of opportunities for you to produce a particular target, and then I can look back after treatment and see where we are. Where did we get to? Okay, so important that we baseline and do it correctly. So you've done your baseline. How do you decide how many target behaviors you're going to address? I have 30 minutes, 45 minutes to work with you. How many sounds can I address in one session? This is really going to depend on you and your client. A number of characteristics regarding the client. But these are general pointers that you should be able in a 45-minute session to address 3 to 5 phonemes if you're looking at articulation. If you're looking at language structures, 2 or 4 structures. Fluency really can go through those main concepts that you're going to use to facilitate fluency. You can go through all of those in one session. Really important for that initial session that the client actually even sees some progress. Okay, so those are pointers, but it is truly up to you. And hopefully you get to this stage here where you discharge a child. It's a bittersweet moment. We have this all the time. The child does really well and say they're done, and the parents are like, no. This is a happy moment, isn't it? You know, this is what we were looking to do. So how do you decide that you've gotten to that point? Number of criteria here. Again, these are just simply pointers. This is up to you. Yeah. You're the ultimate decider in terms of, yes, we've gotten there. But if this child is doing all of these things within a natural setting in conversational speech, you've done your job. And you're done. Okay? Alrighty, I know it's going to be a long, long day. Thank you for your attention.